We've spent the majority of this 2022 webinar series exploring various facets of the rare diseases space, from the role of innovation hubs and centers of excellence to the need for improvements in patient registries. What we often come back to, though, is the intensely personal impact of any rare disease on the patient and their family. Current medical systems, clinician training, insurance programs, and many other organizational structures encountered by those seeking treatment for a rare disease, for the most part, just don't seem able to handle the complexity and uniqueness of these conditions. So today we're going to take a deep dive into this subject, looking at, as the title states, the profoundly personal side of rare disease.
In the United States, there are about 30 million Americans who are diagnosed as having a rare disease and who are considered as having a rare disease. Diagnosis is a separate question, but if you look at that, the 30 million is almost like 1 in 10. And you start thinking through the family members, the social contact of those 1 in 10. And I imagine that every single person listening to this webinar is probably in touch with someone with rare diseases. If you look at Europe, you find very similar numbers, about 30 million Europeans are estimated. And then if you look in Asia, I've had the chance to work in China a lot recently, and the Chinese government has recently been putting out new definitions, a list of more than 120 rare diseases in the last couple of years. So the numbers are quite staggering, John, just in terms of rare and the surprise that it's in fact actually not rare.
You're essentially living in a reality that the medical system is not acknowledging, and you can sometimes grapple with the question of, are your symptoms real or are they psychosomatic? And it becomes very easy for others, friends, spouses, employers, to disregard the very real day-to-day challenges you face if you have no name for the cause of your suffering. And in concrete terms, for me, it was very shocking and devastating to lose my cognitive capacity and be medically gaslit by some doctors into believing nothing was medically wrong, and then to be expected to plan for the future and take care of myself when I had no idea what tomorrow would bring. And I never anticipated that the monster would only grow bigger and slowly disable me over 5 years until I was catatonic.
Having a rare disease, of course, means that, as we have already discussed, it is more likely that we experience diagnostic delay, or may go on for years without a diagnosis altogether. So that is very challenging. The plus side, at least if we are talking about, certain countries like America, where there are some policies that actually protect people with rare diseases. So here in America, I'm thinking about the Orphan Drug Act that actually was created through lobbyists many years ago to ensure that people with rare diseases are being offered drugs, and drugs being developed for this group of people that perhaps otherwise this would not occur, because there would be a perception that the audience for this drug would be too small to make it financially feasible. So policies like this actually ensure that people with rare diseases are prioritized in medical research, at least to some extent.
I think one of the positive things that I have really experienced in the rare community is the coming together of patient organizations, and the willingness of patient organizations to be very welcoming, very inclusive, but also very generous in sharing their experiences, their learnings, their insights, so that as a total community we can hopefully bring more impact and advocate more strongly.